Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, congenital anomalies of the lens. So, in the congenital anomalies of the lens, we have different types of congenital anomalies of the lens and their different things. So, first we have lens coloboma, right? So first we have coloboma of the lens. In coloboma of the lens, the picture looks something like this, where the inferior part of the lens, this part is not able to develop. So this occurs mainly due to the failure of embryonic fissure closure. So here the main problem is failure of closure of embryonic fissure. So as a result, this inferior part of the lens is not formed. So which is called as coloboma of the lens.
thank you and thank you for watching.